It is Monday at 4. It's Tuesday at 4. I hope everyone had a safe and restful Labor Day weekend. I know that there was a lot packed into it. I get to start with a special treat today, showing off school spirit. This is my alma mater, Henry Clay High School in Lexington, Kentucky. I was a 4-year attendee and am a proud graduate of Fayette County Public Schools, specifically Henry Clay. And this was from Sherry Wesley Porter, who was a teacher while I was there and is now a guidance counselor. So thank you so much, very special. I'm also proud to be a graduate and appreciate you feeling the same. Today, we're going to move pretty quickly based on the long weekend, the number of tests and the amount of information, the number of labs open, all pretty low. So we'll talk through what we have today. Because of that, though, because of labs being closed for an extra day, I would get ready to have very large numbers on both cases and likely deaths the next couple days, if not the next 4 or 5 days. It's something we ought to be prepared for, that is both a result of where we are right now as a Commonwealth, but also just the impact of Labor Day weekend, and whether it's the hardworking epidemiologists, the hardworking folks at the lab that have all been working overtime, they too need a break. So we'll start with our Fast Four of the day. The first one will be the meatiest, and that's an update on evictions and our fund. We've got an exciting Riverport funding announcement, and then we'll talk about voting and Mask Up Kentucky. So first, Healthy at Home Eviction Relief Fund. On Friday, after taking repeated steps to keep Kentuckians from being evicted during this pandemic, I updated the state's executive order on evictions to reflect the U.S. Center for Disease Control and Prevention's moratorium on residential evictions through December 31st. Remember, we were in negotiations based on a challenge on our eviction moratorium, but the CDC came and said that it is a public health threat for people to be evicted at this time and put in a national federal order. So again, if anybody ever starts thinking some of this is political, this is on the national, what we were doing on a statewide basis. But even with that, we are going to move forward with our Healthy at Home Eviction Relief Fund, forward with a number of steps we were taking before so that we can get relief to our renters, we can provide some financial help to our landlords, and I think just as importantly, that we don't end this COVID-19 crisis with a separate crisis where we have mass evictions, ruined credit, and people in far too much debt. So we're announcing that Kentuckians, this is the exciting part, can now apply for assistance via an online application at teamkyhherf.ky.gov. Since launching this morning, we know we have almost 800 Kentuckians currently working on applications. We want even more people to apply. As we continue to wage this battle against COVID-19, we want to make sure renters can be healthy at home while, again, safeguarding both them and landlords from undue financial hardship. The state's Healthy at Home Eviction Relief Fund will serve eligible households in 119 of Kentucky's 120 counties. That's because Jefferson County has their own fund based on getting their own dollars from the federal government. It's going to prevent the eviction of Kentucky tenants and reimburse eligible landlords for missed rent payments and potentially pay some rent ahead to keep people in their homes. In other words, it is going to give an incentive for landlords to come to an agreement where they give up a little bit, but they get more assurance both for what people owe and what they will owe in the coming months. So, if you are a tenant at risk of eviction due to COVID-19 or would be, but for the CDC's moratorium, and you live outside of Jefferson County, please visit the website to see if you meet the requirements for help. And if you're a landlord outside of Jefferson County who's owed back rent due to a tenant's inability to pay as a result of this global health pandemic, I urge you to visit the website to learn more. I want to emphasize that both the renter and the landlord must complete and submit separate online applications and submit the required documentation in order to be placed in line for payment, if both are ultimately determined eligible. Landlords and tenants must have one another's email address to apply, but that's something that we should want to work together on. This is something that's going to help out both parties that are hopefully working together. If applications from both the tenant and the landlord are submitted and approved, the assistance will be paid directly to the eligible landlord. Assistance for rent that is overdue can be retrospectively calculated to March 1st, 2020. So real opportunity here to address what could be what is owed in its entirety and at least come to some agreement where everybody gives a little bit but gets in a much better place. These payments could start as early as September 25th. Eligible applications for this program will be processed on a first-come, first-served basis and will close when the funds are exhausted. If you're a tenant or a landlord who believes you may be eligible for assistance, again, visit the website. I also want to remind Kentuckians there are other programs available to help them if they owe back rent. That includes the Team Kentucky Fund. It includes the Louisville-Jefferson County Eviction Prevention COVID-19 Relief Fund. It includes the Jefferson County Eviction Diversion Program. Local governments may also devote some of their funds that they have to eviction prevention and seek reimbursement with the Department for Local Government through the Coronavirus Relief Fund. Federal CARES Act funds have been allocated to Kentucky's community action agencies that they can help you with. And then there's the Kentucky Housing Corporation's Emergency Solutions Grant Program. So to everybody out there that owes, and all the landlords out there that know that their tenants haven't been able to pay because of this virus, there are so many opportunities right now to solve this issue. With all of these funds available, if everybody's acting in good faith, nobody needs to worry about getting kicked out. Nobody's credit needs to be ruined. Everybody can get a little bit of help to get through this. Let's make sure you take advantage of this possibility. And for Kentuckians seeking legal assistance, contact the Kentucky COVID-19 Legal Hotline. That is 833-540-0342. It's sponsored by Kentucky's Access to Justice Commission and Kentucky's 4 civil legal aid programs: Apple Red Legal Aid, Kentucky Legal Aid, Legal Aid of the Bluegrass, and the Legal Aid Society. Lawyers who want to volunteer to provide direct legal assistance to Kentuckians in dire need can do so by visiting Together Lawyers Can. Again, it's an exciting program. It means that we will have, I think, in far excess of 15 million when you put all this together, a chance to try to make sure that we are not continuing to fall behind in this epidemic, but we're getting everybody to a place where we can emerge healthy and where we can emerge successful. All right, that was a bit long, but an important one. Number 2, Riverport grants. Today I'm announcing $450,000 in grants awarded for critical repairs and equipment at 5 Kentucky riverports at Paducah, Eddyville, Henderson, Owensboro, and Louisville. Grants are from the Kentucky Transportation Cabinet budget. Riverports apply for the grants, but they have to match the funding. In other words, you got to have a good idea, you got to have some skin in the game, and we're able to help finalize it. One of Kentucky's greatest natural assets is our abundance of waterways. It's another great infrastructure asset that we can use to bring companies to Kentucky and to create good jobs. Our riverports help move the nation's cargo and create high-wage jobs. It's essential to keep them modernized and well-maintained so we can continue to build that better Kentucky that we talk about. And when we look at this, what better way right now to spend funds to stimulate the economy, to encourage job growth right now, but also to improve our infrastructure, which will save us money in the future. When I look back at the Great Recession, I think one mistake that was made is we didn't put a lot of state and federal dollars that came in into our state and federal infrastructure. And we've been trying to pay to maintain it ever since. This provides us an opportunity to truly invest in ways that are going to pay dividends after we emerge from COVID-19. Let me mention a couple of them. The Owensboro River Authority. We're providing $120,082 towards the purchase of a front-end loader for daily hauling of bulk products. The new loader will replace an unreliable 11-year-old machine. The Eddyville Riverport and Industrial Development Authority, $109,890 towards repair of erosion of the embankment that supports a boat lift near the boat repair bay. Henderson County Riverport Authority, Dorsey Ridley be excited about this one, $108,000 towards removal and replacement of two 40-year-old damaged mooring structures called dolphins, essential to the operation of the loading docks. Louisville Jefferson County Riverport Authority, a little over $95,000 towards repair of a rail line by replacing 1,000 wooden cross ties with 49 switch ties. And the Paducah-McCracken County Riverport Authority, a little over $16,000 towards the repair of a loading chute on the conveyor system that moves commodities from the river to the Riverport sand and gravel yard. And if I can just stick on this one for a minute. With the announcement we made before COVID-19 of providing funds to make the new airport terminal in Paducah a reality, with the significant funding the federal government just put in that same project, with this Riverport Authority that is really exciting, and as we move towards furthering I-69, both Paducah and this Western Kentucky region are poised for real growth. Think about that infrastructure with multiple interstates, the Riverport, a large terminal and airport capacity. It's going to provide opportunities that we have not seen before in that area. All right, third on our quick four this morning, vote. Vote, vote, vote. Just vote once. But you can vote through any number of options. Folks, this is the easiest it's ever going to be to vote, and you can do it during a pandemic in a way that keeps you safe. I'll tell you what, Virginia, we haven't done this in a while. Will you teach us the sign for vote? Will you do it again for us? All right. And I know that there are many kids and many parents that have watched and learned sign language, so for every child out there, every day when you see your parents, please teach them that sign of vote. You can do it right now by requesting your absentee ballot. If you're going to vote via absentee ballot, and I am, make sure that you go on and you request it now. It gives it time to get to you and then return it as soon as possible. Just follow all the instructions. There's going to be 3 weeks of early voting, and then there's going to be multiple polling locations on Election Day. Let's have the biggest turnout that we've ever had in Kentucky. Let's show people that if you make voting easier, more people vote. I think that'll be a pretty good argument to making it easier for people to vote moving forward. Finally, Mask Up KY, Mask Up Kentucky. This is our greatest tool, our most important tool to getting back to everything that we want to do, about getting back to in-person classes. I think this next coming Monday, Dr. Stack is going to do a deep dive into school and some new tools he's working to develop. But this helps us to protect our economy. This helps us do so many things. And so we're asking you to continue to fill up social media with the positive. We see too many conspiracy theories. We see people intentionally trying to mislead you on COVID-19. We see other governments that want us to fall apart out there, trying to push a false narrative to either tear us apart or keep you from doing something that keeps you and your family safe. Listen, whether it's Russia, Iran, or North Korea, they all want us to be unhealthy and unsafe. Let's not help them out. So let's make sure we're pushing out the positive media that's out there, and I want to go through a couple. This is from yesterday, but this is one of our frontline healthcare workers talking about how important it is to wear a mask. You know, when we first were dealing with COVID, and we all felt that pride and that civic duty that I hope we still do. And we're probably going to have to talk about that later this week as we approach some tough milestones. Do you remember when we talked about how much these individuals were sacrificing and how we should sacrifice for them? Pretty darn easy to wear a mask, to support people who walk into COVID wings every day to take care of your loved ones and mine. All right, and how about our teachers? That as we move towards going back to in-person instruction, this will be more important than ever, making sure that they not only have it, but again, if you want your kids back in school and in class, which I do, and I think we are moving there, and I have confidence we'll get there by September 28th. But if you want your kids back in class, and you care about their teachers because they're a lot better at teaching your kids than we are, we've learned that, wear a mask at home. Have your child wear a mask when it's appropriate. It'll make it more likely that they have the practices when they are in class to protect that teacher. And remember, if we have an outbreak in our schools, then you're going to be in the same spot you're in right now, which is unsatisfying. Do the right thing, mask up. All right, this is pretty neat. This is Henderson County. This is Henderson County Day, apparently. And this is the staff from Ben Gate Elementary School taking time to thank students and parents for their hard work during the past 8 days of online instruction. Pretty neat. Opportunity for kids to see their teachers. And this is the best of us with teachers. They recognize that it is an extra obligation. I don't want to say burden, because this is the education of our kids. It's an extra obligation on our parents right now. And I hope that when we see how important that school is, when we see how hard it is to do what our teachers do, that we make sure that we never think about our schools being childcare ever again. Now, our schools are a place where our kids go to learn, to get the skills that they're going to need in our world to develop their minds. These teachers do incredible work, and I think that we've been reminded of that. And finally, a little bit of sports. This is Anna R. Williamson. She wants to get back on the soccer field. She realizes that her ability to play depends on us being able to control this virus. Everything we want to do depends on us being able to control the virus. You want her to be able to play sports, and I do. You want to make sure that we get as much of a season in as possible in any of the sports. Wear your mask. It's really that simple. Your choice is, if you want all those things, are you going to do what it takes to support it? I know that I am. All right, today's report. So we talked about the fact that with the long weekend, we in fact have less data that comes in on most Sundays, which we report on Monday or the Mondays for today. In fact, we only have 1,393 tests that the data comes from today. So when you look at what we normally have between, it could be 8 and some days up to 17 or 18,000, it's a very small sample. So today we have 273 new cases of COVID-19. Now on some good news, but again, we expect this to change during the week when a lot of these results come in. For the first time in a long time, we're under 4% on our positivity rate. It's at 3.91%. My hope is that we'll be able to sustain that or the low 4s as we go through the week and all the information comes back in. Depending on how much information comes in and how many positives there are, this could be just a result of limited reporting over a couple days that go into that 7-day average. But remember, if we can get especially below 4 and stay below 4, if we can be going down, then we're in a place where we have a lot more opportunity out there and it is a lot safer. Total number of cases now, and we're always going through this data, 53,319. Today we're reporting 1 new death. Now, again, part of this is our committee that goes through and analyzes each of these to determine if they are truly a COVID-related death. Also took some time off. So as we sit at 997, I can tell you there are over 20 cases in the queue that are being looked at. It is going to be a difficult month. Last week was the deadliest week in terms of lost lives that we had, and we're going to see more of that moving forward. When we look at new cases by county, 59 in Fayette, 50 in Jefferson, 42 in Warren, still a lot for the small number, 43 out of 273 in Warren, 13 in Madison, and 11 in Marshall. It appears that we are seeing more coming out of Marshall. I saw that there was at least a third positive test out of the school system. While I disagreed with that school system going back when they did, it does appear that they are publicly reporting cases. That's a good thing. That's showing responsibility. Hope they're working with the local health department to make sure that the right and responsible decisions are made, but certainly that reporting suggests that process is being followed. Total number of tests to date, 929,212, 510 Kentuckians currently in the hospital for COVID-19. That includes one of our state senators that we ought to be thinking about, Senator Neal. Talked to him today. He's in good spirits. He had about 10 pieces of advice, and it was good to hear that from him. Representative Attica Scott apparently has also tested positive, is not in the hospital, to my knowledge, doesn't need that level of care. But I appreciate her publishing the fact that she's going to follow the guidelines, that it's her responsibility, and it's setting a very good example. We wish them both the best. No reason to think we're going to have any negative outcomes in either of those cases. 130 Kentuckians in the ICU, 74 currently on a ventilator. If I can get from our communications team the one death, the information on that, I don't think I have that in my information. But we do have a loss today that we're recognizing. It occurred earlier in this virus, but again, we wait to be able to share some of these stories. So today we're remembering Gaynell Howard of Louisville, one of the beloved Kentuckians lost to the coronavirus. She was 89 years old and loved by her family. She was the mother of 2 sons, a grandmother to 5 grandchildren, and a great-grandmother to 4. They described her as generous. She never forgot a birthday. She always offered words of encouragement. Her children said she was a great mother, always patient and loving. That's not easy as a parent, the patient part. She loved to read her Bible and always attended services at Eastern Star Baptist Church. The last time her family spoke with her was on March 9th after Trayton Oak Tower, where she lived, stopped visits because of the virus. She passed away on April 13th. During the last conversation, her family told her, "We love you," and she told them the same. Let's just remember that as we approach, though we haven't hit it, 1,000 deaths in Kentucky that are related to COVID-19, that these are real people that we love and that we care about. Not just numbers, not something to argue about whether it's real or not. Real people. And don't tell anybody in her family, "Oh, she was old." No, she was special. She had more years left in this world, and they were taken from that family because of COVID-19. And today's loss, our reason for having those green lights and ringing those bells at 10 a.m. is a 79-year-old man from Lewis County. Let's look at child care facilities. We have 13 new facilities with at least one reported case. 10 new staff have tested positive, 5 new children. K through 12 Kentucky schools, this is since Thursday. 10 new students, 3 new faculty or staff. 43 new schools have had or have dealt with at least one new case. Again, you see the active cases versus the total cases. And as we move towards getting back to in class, it's going to be really important that everyone follows the guidance from local health departments and other requests, because what we're going to see is a number of children, but also it'll be their families that'll need to be quarantined. So remember, if one of the reasons you want to get back is getting to work and getting your kids back in school, we just got to understand that the expectation and the requirement for everybody is, if there's a reason where a class is quarantined or a group or hopefully not a school, that with the interaction with those kids and the parents, you're probably home from work for that period of time too. So understand the sacrifice that it's going to take as we move towards that, and it's going to not just be getting back to what you might consider normal, it's going to include a lot of disruption too. I know a family that just got done with the quarantine based on a positive case in their class, and they did it. They're great folks, but it's not easy, and it's going to be a very different school year in that way. Colleges and universities, 63 new students, 0 new faculty or staff, 1 new institution. You can go online and you can look by school, by university, at our comprehensive report. I think on Monday we'll have an update on faster ways that parents can go online and see what the current situation is in their region, in their school system, and hopefully we can get to a place in their school. Because I hope every school wants to give regular daily updates so any parents who've made decisions about remote learning or in-person learning can make the best informed decision or change decisions. I think that's part of our duty to those parents. All right, with that, we will open it up to questions. We got a number of folks here today, and also a couple of questions that have been written in. I think we started with Debbie on Thursday. Am I right? I think we did. So, Nick?
A question about the rent help. Obviously, that's affected a lot of people. Is the state prepared for a very, very, very large influx of people that are going to try to take advantage of this and use it?
The question on evictions is, given everything that's out there, is the state ready for a large influx of applications? I believe we are. We're going to get some extra help as we get a little down the road from the Kentucky Housing Corporation. They are setting up a much larger administrative group to handle those claims as we come. We thought it was important to get our website up early, so finance is going to collect the initial data and move it over to that group. They are planning and have budgeted for, because I saw the budget, a significant number of applications, and having watched where we had a big push on some of our groups like UI. They wanted to make sure that they were going to get it right. I just wanted it to also be a little faster, so we met in the middle of being able to accept applications. But yes, I believe that they are going to be ready. And I'd want to remind folks, remember, Community Action Council, separate application process. Team Kentucky Fund, separate application process. There's a lot of different avenues you can get out there and get that help. Tom?
Thank you, Governor. Federal Bureau of Prisons has now allowed visitation at their facilities. Where does the state stand on visitation of state prisons?
At this moment in state prisons, we do not have visitation. It's something that we can always look at, but we have had some real significant outbreaks that we are trying to get control of. We have had allowed for more calls or more FaceTimes or more means of communication because we know how important that is with people's families. Moving into the future, we may be able to look at the stability of the prison, but again, we see these outbreaks occurring and how bad they can get really quickly now with the numbers we've had. I'd want to know the Bureau of Prisons and their decisions based on that. They've had some really bad outbreaks too, one that the magnitudes of which we haven't seen in Kentucky, even though we've seen some significant ones.
Early indications. Are you hearing of any reports about large gatherings, bars being overcrowded this past weekend? Things we saw.
The question is, have I received early reports of things being crowded or overcrowded over the weekend, bars, et cetera? I haven't seen any of that directly. I know that the week before there had been some complaints specifically in downtown Lexington about one institution staying open later, openly defying, and I know that Lexington's ABC was planning on doing something real and significant about it. Now, if you're one that's following the rules and you see somebody that's not, I know it can be frustrating, but please don't say we're not going to do it if they're not doing it. Let's just try to do the right thing, and the enforcement is going to be out there. They will be working. Sometimes we need to work a little bit more on it. I get that. It needs to be fair across the board. And as we move forward, we will consider new ideas or different ways maybe the restrictions can be implemented to try to provide some relief. But remember, we're operating bars and restaurants at a higher level than the White House recommends, because we think with some of the steps we do, it can be done safely. And we also worry about large house parties if we don't have certain options available. Karen, welcome back.
How are you feeling on a possible, those schools who are going to go back to in-person near the end of the month, are you still feeling good about that date? And even though you didn't recommend it, have you had a chance to talk with any of the schools who have gone back of what's going well or what isn't?
The question is, how do I feel as we get close to September 28th about where we're going to be on schools, and have I talked to some schools that have gone back? I have spoken to a few ultimate administrators of schools that have. It's hard. It's hard given where the virus is right now. I believe that everybody is trying. My concern, laying out my concerns when we go back to school, is there's a lot of pressure when you have that first positive case, and wanting to make sure under pressure that those in charge make good decisions. Under pressure, people can make bad decisions. That's just natural. But needing to be open, needing to work with the local health department, not refusing calls, not refusing the advice that's given. We need people to basically say we're gonna operate under our plan. But once we have a positive, local health department's coming in, and we're gonna listen and we're gonna do what they say. Because at that point, as a school administrator operating your plan, yes, you're in a good position to do that, but you are not a public health official. And at that point, that local health department needs to have some wide latitude to do the right things. I believe that by September 28th, it'll be time in counties that choose to move forward. And I think Monday we're going to provide some extra tools to give some extra data to try to make those very best decisions. I think we ought to expect what Greene County went through. They opened, and then they saw indications of spread in their community. They closed to in-person classes, and their decisions has borne out when you see the numbers and how they increased there. So just because someone says, all right, we're going to in-person classes on September 28th, it can't be, and we're going to do that no matter what. It has to be if a community spread is getting really big, we realize where we are, and if we want the best shot of having the most days in class, and we got to follow that advice.
$500 billion or so coronavirus relief package. Have you seen any details about that? What are your thoughts about it, and just in general, where things are at with the coronavirus bill?
The question is on Senator McConnell's coronavirus relief bill that is being unveiled, I guess. I think there was just a floor speech, and I just got a couple notes from it. So I'm not sure everything that's in or that is not in it. I am told that $300 of unemployment help is in it. I guess if that passes, it means that the president's amount and the structure we set up the last couple weeks to do that would not be active, but this one would be. And if that's the case, I hope they do it in the same way we did the $600. Otherwise, we got to rebuild something else. I don't know what's in it about state and local budgets. It's just got to include one of two things. Either new dollars meant to stabilize those budgets. We're talking about education, healthcare, public safety, things that are critically important. Or it needs to give us additional flexibility in spending the funds that we've already received. Virtually every state is sitting on a significant number of those funds because it's been repeatedly told to us as governors that, well, you might just be given flexibility there, and if you spend it all, good luck. That could result in crippling budget cuts. So we need some certainty on which one, if either of those, is going to occur. Now, I hope that the unemployment dollars will come up. If they don't want to do $600, I hope they'll at least do $400. What we see from that isn't just about individuals, though we like Kentuckians having that help and care. We have seen it flow through our economy in a very positive way. It's got us in a better place for recovery. But other than that, I'll need to see the details. I'm glad something's moving, and I hope that there will be good faith negotiations and not people walking away from a table or not being able to negotiate a resolution at a time of crisis. Lawrence?
The state has begun taking applications for in-service unemployment help. talk about that if you would?
Our Frankfurt office has once again opened up appointment-only in-person assistance. We had a COVID scare ourselves not too long ago on one of the last days or set of days where we were doing the in-person service. It meant that we needed to, again, look at our workforce and determine what it could mean to the processing of unemployment claims if we had a spread. So we think we're in a position, again, to restart that. We're going to be looking at other regional opportunities. Now, they may be regional in-person or regional virtual with an appointment for that region, but it would still be that one-on-one ability, either through video or phone or potentially in person. But again, what we've been trying to do is get through as many of those decision letters, those 2-page letters that are holding up claims as possible. We are making progress on that. With EY's contract extended through the end of the year, we're moving in the right direction. I believe it lasts through December.
On the voting, the president continues to raise concerns about the security of absentee and mail-in voting. How confident are you that Kentucky will be secure? People are worried about fraud and they keep hearing about it.
The question is based on the president and others talking about their beliefs on security of mail-in votings or of absentee. How secure do I believe it is? I believe you have a Democratic governor, a Republican Secretary of State, a nonpartisan Board of Elections that are all saying it is safe to vote by absentee. As long as you follow the directions, your vote will be counted. We do need you to request it early and get it in early. Our only concerns are about the work in tabulating it, and everybody out there can help us with that. We just got through a primary election with, I believe, the most absentee ballots we've ever seen by a lot. And we saw that the system went well, no fraud. I believe that security's in place, and I believe that people can rely on what people coming together in a bipartisan fashion, all agreeing on, are telling them. Our Secretary of State's done a great job in the security side of this, as has the Board of Elections. I think it's what happens when everybody just decides that voting is incredibly important. A pandemic is a bad thing. Let's get a good solution. Doesn't have to be complicated. Nick?
Surprised at all if there's an increase in cases 2 weeks from now from Labor Day, or should it just be expected?
The question is, should we expect an increase of cases 2 weeks from now based on Labor Day? Depends if people followed the rules. My concern lately, and I'm going to address this later in the week, is we hit these points in time, and you can feel them and you can see them, where people get tired of dealing with the virus, and I get it. We're all tired of dealing with the virus. I remember the first day of summer was one, and we heard people say, "Don't steal our summer." Well, can't make the virus go away, so we have to do summer a little bit different. I feel that late August was another one of those times when the normal school year starts. Again, I've heard of a lot of people having 10 people or less for the events they are doing. It will all depend on how well we followed those rules. I think we are seeing not maybe the start of an increase in our cases, but we'll see these next couple weeks. But part of it's going to be natural. If we're getting back to in-person classes, if we're doing high school sports, people are going to have more contacts, and if we're doing our testing, we're going to have more cases. The question is, where's our positivity rate? If people are going out there and getting tested, and how many more? I'd like to think that if we're doing this right, and if we follow all the rules, we can see it move downward. But do I worry about this weekend and everything that was packed in it? I do. Tom?
Early on during the pandemic, we had 2 cases in Kentucky, I believe, of the multi-system inflammatory syndrome in children. We have seen an increase in those under 18 testing positive. Has there been any more, are you aware of any more of cases of this disease?
Okay. Steve, you want to come up and answer that? That's worth it. This is a question about the syndrome that has hit at least a couple of kids here in Kentucky, where they develop inflammatory syndrome. a while after they've had the virus. And then there's a question that's written here on universities. If you don't mind addressing that after Tom's.
Thank you. So Tom's question is about the pediatric multi-system inflammatory condition that develops after coronavirus. So remember, we wouldn't see that right away. That happens often 2 to 3 months after children get infected. It's not part of the acute infection. It's the body's immune system becoming hyperactive at a delayed time frame later. So as we see the number of young people testing positive increasing, if that's going to become a bigger problem in Kentucky, we will see that probably sometime in October, November, not right away here at the beginning of September. And then there's a question here about Murray. Why am I? Oh, here we go. It's, can you please specify when a college student has received a positive COVID test, what the guidelines are in order to discontinue quarantine and go back to the university? So the guidelines for release from quarantine are posted on the website under the healthcare providers link. So the rule that the CDC has is 10 days after your symptoms begin or you test positive. So if you don't have symptoms, we have to use the day you test positive. 10 days after that, your symptoms begin or you test positive. When your symptoms are gone for at least 24 hours, then you're cleared. So if you get hospitalized and you have moderate to severe or severe or critical disease, then we extend that to 20 days. But for most people, if you have mild, it's actually mild to moderate disease, 10 days after you test positive or your symptoms begin, and you are symptom-free for 24 hours, then you are cleared from isolation. So for most people, that's 10 days.
Question is on what I expect to come out of the selection of Yvette Gentry as LMPD's, I guess, interim police chief, and I've not had an opportunity to talk to her, though have had a number of discussions in the past at different times with her. She is someone with a significant career in law enforcement, is someone that has been a great leader and administrator in everything that she has done. I believe has been successful at everything that she has done. She is smart, incredibly strong, will tell you exactly what she thinks, and I think that that's important. I believe is going to bring it has the opportunity to bring multiple perspectives and groups at least into a dialogue and have a conversation. I think this was a good move, just a high quality individual, and we ought to be thankful that she's willing to step in and take over this role while there is, in my understanding, while the search goes on. I think it can be very positive.
Both touched on last week the importance of safety over speed with the vaccine. Today, 9 big pharmas came out and said the same thing. We're not going to rush this. What's your reaction?
The question is my reaction to the pharmaceutical companies that are working on various vaccines, and it is a positive that we have multiple ones working on it. It gives us the possibility that we will have multiple vaccines. And when you look at the production and what it'll take to scale up, that may be really important. It may help us to ensure that when it is ready and safe, when they are ready and safe, if there are multiple, then they can actually get to people faster. These companies came together and said they are not going to rush a vaccine. I think that's important. It's important because you look at there are some instances in the past, I think was it the polio vaccine, where they actually gave kids polio because something was rushed. So first, there's safety. This is something that we're going to hope that billions of people are willing to take, ultimately around the world, right? Because we want to eradicate this around the world, or at least battle it. The way we've seen it move between countries means that we're looking at maybe the largest scale vaccination in our history, and we certainly will want it to be, when it's safe, fast, and significantly scaled here in the United States. But people have to have confidence. There's already people out there that don't believe in vaccines. I do. I vaccinated my kids. I would do it again for what their pediatricians recommended. This is one where, if it is pushed really, really fast, it's going to undermine the confidence. We need to make sure it's safe, and then we need to get it out to as many folks as possible. Now, I do want to set expectations. Even if, and I think this is a stretch, even if someone applies, I think I saw on the news, the end of October, early November for approval, by the time this thing could get through all the last steps it would need to take, but more important, to manufacture the hundreds of thousands or millions of doses that would be needed, we're looking at next year, regardless of that. But I'm going to make sure that I comment when I think it's safe, that we comment on any concerns. And I tell you what, I will take the vaccine so that the people, when I feel confident about it, so the people of Kentucky can see that I'm willing to do it. And we can do it right here at 4 one day, or we can figure out another time.
With today's update, 273 new cases out of just 1,393 total tests. That's a very high positivity rate, which is that one day alone. Does that sound for alarm for you, or what do you read into that specific?
The question is on the numbers today. It's just really hard to tell on a single day with so many labs that are closed. We might not be getting all their reports of negatives, but some of their reports on positives, depending on how they report and to who. Remember, different labs go in different directions, and they all come back to us. Some report federally, and it comes back. I think if we get 2 days from now, we'll have a better idea of what it is. But tomorrow could be comparatively a huge number, just because of nothing or fewer labs being open the last couple days. And so this week, more than any other, we're going to have to look really at 7 days, maybe even a few more, to know exactly what's happening. Lawrence?
Advising universities and I assume other agencies, state agencies, to prepare for 8% budget cuts?
The question is on our budget. I talked just a little bit ago about our need for state and local government budget relief. This is something that was done in the Great Recession when we weren't battling a international health pandemic. It was something that helped us bounce back from what could have been a worse recession, though it was a deep one. Now, we stand in the same place, except people's health and lives are also on the line. And the length of time that we're in this recession, in part, is going to depend on how well we fight this virus. So we need the same thing. We are getting different projections that we have to plan for on the impact that this is having on our budget. And it is significant. I will say that it does not look as bad as initially projected, which was largest budget cuts ever of all time. And that's in large part because of the unemployment aid that has filtered through the economy. In some small ways, we've been able to use the CARES Act funding. With that said, we have a range of different projections, depending on how things go, that could require, without any additional federal assistance or easing of how we can use money, up to 8% budget cuts. 8% budget cuts are hard. They would again be some of the largest that we have ever had. They would impact services. They would, we've already cut through the muscle. They would cut deep into the bone. They are something that when those plans go back, I hope should show everybody, including Congress, just how damaging this can be. That doesn't mean that we will ultimately have 8%, but it means with the different scenarios we're looking at, without federal aid, that's what we got to be prepared for, at least have a plan for. And I believe in planning. It's the only way that I ultimately can look across cabinets and see some unintended consequences, how devastating some could be, and adjust it if necessary by that. We will obviously look to prioritize education, healthcare, and public safety. And there are certain areas of state government that we can't or we won't cut because of their importance. Now, that does mean other places get hit harder, but You got to have priorities in times of difficulty.
Did you have your discussion of the Black Caucus yet today? Did you a special section as part of that discussion?
The question is on a conversation that I've set up with Kentucky's Black Legislative Caucus. It is actually at 5 o'clock, about 7 minutes from now. One of the reasons that I requested this conversation was Senate leadership, I think it was last week, talked about at least the possibility for a special session. But I believe they did it without consulting with, any guidance from, or any discussions at that time with Kentucky's Black Legislative Caucus. And given that at least one of the senators talked about one of the things that could be addressed is institutional racism or racism in general, about, I believe her words were police reform and others, that this is a place that we've got to start. And these are leaders that deserve to be heard, and I want to make sure that that's the first conversation that I have. Now, we have numerous conversations with other groups planned out, and the idea here is to determine if something is truly possible. Because it's one thing, without having consulted many of those that should have a voice in this, to just kind of talk broadly about something. It's another thing to see, can we make real progress? And before we call people in for a $60,000 a day special session, I want to make sure that real progress is possible. So we're going to figure out what all those ideas are and how to put them on the table, but also bring everybody to the table. I think one of the things that people are giving voice to right now, whether it's in the streets or other opportunities they have, is being left out of so many discussions. We're not being included in the beginning of those discussions. And I want to try, at least in how we're going about that, to rectify that, or at least set an example of doing it the right way. All right, folks, low numbers today, but that's because of how the reporting is coming in. We ought to expect a tough day tomorrow and perhaps to pass a very difficult milestone. This is very, very real. James, can you put up the individual that we recognize today? I just want to leave you with her picture, because when you get caught up in the numbers or you get caught up in social media, people trying to tell you it's not real or it's nothing more than the flu. I mean, this thing is getting close to taking 1,000 Kentuckians, more Kentuckians than died in Vietnam or the Korean War, losing 1,000 people to something that didn't exist 6 months ago. It ought to tell you what we're truly battling. And if we have to deal with it for another 3, 4, 5 months, we stand to lose substantially more. I'm going to talk about that more and in detail later in the week, because we got to pick it up. We got to realize that when we get tired and we walk away, when we just decide we want to go back to our old lives, other people's health are impacted and some people die. That's not fair, but you know what? Most every generation before ours had to sacrifice significantly more in challenges that they faced. Let's make sure the challenge of our lifetime we don't walk away from because we're tired or we want to have a big Labor Day weekend event. Let's make sure that we answer this calling, that we do it right, and that we protect one another. I believe in my heart we are good people in Kentucky. It's why I wanted to be your governor. Now more than ever, it's time we live up to being the good people we are. We'll see you tomorrow at 4 o'clock. Thank you, Virginia.